Hello. How are you? My name is Whitney, and I'm the nurse practitioner student that will be seeing you today. So for the purpose of this exam, I will not be wearing a mask as this is my cousin and we are together all the time. And we do have parental consent to do the exam without the parent in the room. So we're going to start off by asking a few questions and then go into the exam. But if you have any questions or concerns throughout, I just feel free to stop me whenever you feel like it. So first off, do you have any allergies?
No.
Do you take any daily medications?
No.
Have you ever been diagnosed by a doctor with a medical condition?
No.
Have you ever had any surgeries?
No.
Okay. Does any of your family members have any big major medical conditions like heart or stomach problems,
No.
diabetes, anything like that you can think of? I can go over that with your parents too, but okay. And for your social history, can you tell me where you live?
In Edinburgh.
Okay, and do you live in a house or an
I
apartment?
live in a house.
Okay. Do you have your own bedroom?
Yes.
Do you have any siblings?
No.
Pets?
Yes.
What pets do you have?
I have a leopard gecko, 2 cats, and a dog.
Oh, cool. Okay, and then for how you view yourself. So, what strengths do you think that you possess? What are some things that you're really good at, or really passionate about, or that you feel makes you a better person? Like, do you like making bracelets?
Yeah.
Yeah. Do you like hanging out with your friends?
Yeah.
Do you see yourself hanging out with your friends kind of more than your parents lately, or no, you still hang out with your friends? That's good. Good. What about arts and crafts? You like those? Okay. Shopping?
Yes.
Me too. Okay, so those are some good strengths to have. How about in school? How are you doing in school?
Good.
Do you like it?
Mm-hmm.
Can you tell me like what classes you take during the day?
Math, language, spelling.
Good. Are your grades pretty good?
Mm-hmm.
Do you have good relations with your teachers and friends?
Yep.
Good. And for your okay, so we just have to ask everyone this, but have you ever used any drugs or smoked cigarettes or consumed alcohol?
No.
Okay. And for the purpose of this exam, we're going to defer the puberty and sexuality portion. And then the other question we have to ask is, have you been feeling down, depressed, hopeless, or sad lately?
No.
Okay. And now I'm going to move on to your nutrition. So could you tell me what you had to eat yesterday?
I had cereal for breakfast, and we stopped by McDonald's because I was coming back from the beach. And then for dinner, I had pasta with spinach.
Okay, that's a good meal. Good, okay. How often would you say that you engage in physical activities? So that could be like walking, or I don't know if you play sports.
I walk a couple times a week.
Okay, that's good. Okay, do you walk with your family? That's good. And then what about when you use the bathroom? Did you have any difficulties peeing or having a bowel movement?
No.
Okay, and when was your last bowel movement?
Last night.
Okay, good. And then sleeping. So how many hours of sleep would you say you get at night? You go to bed. What time do you go to bed? That would be easier.
Around 11 to 12, but since it's summer.
Okay. And then what time do you wake up?
Around 9.
Okay. And when you go to bed, do you feel like you sleep well?
Mm-hmm.
Okay, that's good. All right. So do you feel like you have a good relationship with your parents? Or you?
Yes.
Okay, good. When your parent comes back in the room, I'm going to talk to them a little bit about some developmental milestones that we haven't already addressed with you, like your maybe like your ability to stay focused and your attention, your handwriting, how you respond to authority figures, just some things like that. Nothing bad, but stuff that they should have their input on as well. And we're going to compare your height from the last visit to this visit, and obviously you're very tall. So have you had any growing pains?
Yes, behind my knees.
Behind your knees. Okay. Have you taken anything for that?
No.
Okay. We can discuss what we can do about that later. And then, yeah, okay, we're going to move on to the physical exam portion now. For general presentation, I'm just looking at you overall for any obvious deformities, any obvious masses, noting that you maintain eye contact is appropriate, your speech is clear and comprehensible, you're very pleasant, well-groomed, no obvious concerns with your gait as you can walk in here. You're alert, you're oriented. Yeah, okay, so now I'm going to move on to the head portion of the exam. So I'm basically just looking at your head, looking at the size and the shape, looking for any obvious masses or deformities and symmetry. And now, is it okay if I palpate your hair here? Okay, I'm just going to feel your scalp. And I don't see any scaliness or masses. Your hair is evenly distributed, it's long and pretty, and it's very appropriate texture, good hygiene and everything like that. Now I am going to move down and focus on your eyes. So I'm just looking at the overall position and symmetry of your eyes and the shape, looking at your eyebrows and lashes, your sclera, your conjunctiva. I'm just going to palpate your lacrimal sacs and glands. Good. I'm going to palpate your sinuses. Any tenderness? Okay. All right. And I'm going to take my little light here. I'm going to shine it in your eyes, okay? Okay. So first, if you could just focus kind of on my nose, I'm just going to look at your pupils. Good. You're equal and reactive. And now looking at accommodation. Good. Perfect. Okay. Now I'm going to kind of, if you'll stand kind of straight or stare straight over my shoulder here, and I'm going to look in your eyes, okay? Including your red reflex and vessels. Perfect. I'm going to move to this side. And our red reflex and vessels. Perfect. Thank you. And I'm going to have you now follow my finger to check your extraocular movements. And this is just checking for any nystagmus, which I don't see. Perfect. Now if you can follow my finger into your nose. Good. Okay. Now I'm going to look at your ears. So I'm just looking at the overall symmetry, head position of your ears. I'm going to palpate for any tenderness or masses or any obvious deformities with your ears. You have cute earrings. I'm going to switch this over here. Okay, I'm going to look in your ears. Looking at your tympanic membrane, noting the cone of light and any bony prominences, which everything looks good in there. And let's keep this here. Good. Perfect. Thank you. And now I'm going to look at your nose. So I'm looking at the overall position of your nose, looking for any deformities or anything like that. And I'm going to palpate your nose. So can you try to breathe in? Good. And again. Good. I'm looking at your nasal mucosa, your septum, your turbinates, which looks good. All right, and now I'm going to move on to your mouth. So just looking at the overall position of your mouth and lips, it all looks good and even. And I'm going to let you open your mouth and say ah for me. Noting your uvula, the color, its midline, looking at your teeth and your tongue and your buccal mucosa. Everything looks good, and obviously I can see you can stick your tongue out and it's midline, which looks great. Now I'm going to feel your lymph nodes in your neck and your trachea. Okay, so I'll start here. Good. You're excited to go back to school in the fall? Let me know if you have any tenderness here. Are your parents ready for you to go back to school?
Yeah.
Can you swallow for me? Perfect. Any tenderness there? Okay. Now I'm just looking at your overall skin, looking for any scarring or lesions. It's appropriate for ethnicity. Can I see your nails? I'm going to check your capillary refill, make sure it's less than 2 seconds. That's great. Your nail polish is cute. And your extremities feel warm. Rest of your hands and arms. Okay. Now I'm going to apply some pressure on your shoulders. Can you raise your shoulders against me? Good. Can you turn your cheek into my hand? Good. And again. Perfect. Okay, can you kind of puff your cheeks out? Good. Okay. Great. Now I'm going to check your skin turgor, which I'm just going to kind of grab your skin here and just check your hydration status. Good. I'm going to move to the back behind you, and I'm just going to look at your back. I'm looking at your breathing patterns, if you're using any accessory muscles, your AP diameter here. Hope that doesn't tickle you. I'm just going to feel your back for any masses or tenderness. And I'm going to assess your kidneys for CVA tenderness. Perfect. I'm going to feel your spine. All the way down, bottom. Good. And I'm going to quickly percuss your lungs here, which that just tells me how it sounds in there. If there's any gunk or anything like that, if you have a cold, that's what that would show. Perfect. I'm going to listen to your lungs. So as I move my stethoscope, if you could take a deep breath in and out. Okay? Go ahead. Good. Perfect. And now I'm going to essentially do kind of the same thing on your front here, looking at your breathing pattern, stuff like that. I'm just going to feel for any masses or tenderness throughout. I'm going to percuss. For the purpose of this video, I'm not going to expose her in a way to do this the proper way here. Good. And I'm going to listen to your lungs again. You can take a deep breath in and out when I move the stethoscope. Good. I also can go ahead and percuss your front. I didn't already do that. I think I did that. Okay. All right, now I'm going to just kind of do a cardiac exam, which is your heart. So I'm looking to see if I see any pulsations, lifts, heaves, anything like that, feeling for any thrills. And I'll assess your PMI when you lay down. So I'm going to start by listening to your heart in a total of 5 different areas, okay? You can just breathe normally, you don't have to breathe deeply. Nervous point, tricuspid, and mitral. I'm going to do it again, just quickly with the bell. Okay, good. Now, can I help you kind of lay back here on the table? And I'm going to listen to your heart while you're laying down. And in real life, we kind of want you to be a little bit elevated, but we're going to go off over what we got here. So I'm just looking for any pulsations or lifts or heaves. And then your point of maximal impulse if it's palpable. Good. I'm going to listen to your heart again in the laying down position. Let it. Hold on it. First point. Tricuspid. Mitral. And in real life, I probably listen to this a little bit longer. But for the purposes of the video, it will be faster. laying down, I'm going to go ahead and do a quick assessment on your belly. So looking at the shape and contour of your abdomen and for any pulsations. And before I start pressing on your belly to feel for any tenderness, I'm going to listen so I don't stir things up too much. You can breathe normally. Good. I'm going to listen to the arteries in your belly. The aorta, renal, iliac, and femoral. And then I'll do the same with the bell. Okay. Now I'm going to percuss your abdomen, same like I did on your lungs. And I'm just going to lightly kind of press on your stomach. Any tenderness? Okay. Now I'm going to do a little bit deeper, but it shouldn't be painful, so let me know if it is. Good. And I'm going to feel your spleen and your liver, if they're palpable. So you can take a deep breath in for me. Thank you. And to your other side. Take a deep breath in. Good. All right, and I'm also going to, I would be feeling your inguinal lymph while you're in this position as well. Okay, and I'm going to just take a quick peek here at your belly. For the purpose of the video and privacy, I know we didn't want to leave you exposed too much, but just to see that. Perfect. Okay, you can sit up now. Thank you. And while you're sitting, I'm going to go ahead and listen to your carotid arteries, which are in your neck. So do that. And then some info. You can breathe normally. Or actually take a deep breath and hold your breath. Perfect. You can breathe. And again, deep breath and hold it. Good. You can breathe. Same thing. Good job. Okay, and we already kind of felt the temperature of your extremities and did your capillary refill, but I'm going to check for any edema in your legs here. And that's just any swelling that's more than usual. I'm going to feel your pulses bilaterally, your pedal pulses, your posterior tibial. Good. All right, I'm going to feel your pulse in your wrists. Perfect. And then we would also be feeling your femoral pulses as well for the purpose of this video. Okay. All right, now we're going to move on to the musculoskeletal portion of this exam. So I'm going to start by feeling your joints. I did your spine and your neck. So I'm just feeling them, and I'll also be feeling throughout for crepitus, the temperature, any swelling, and as you move your tone, okay? So I'm going to have you kind of do a little bit of motions here. You can look down and up normal and lean back and to the side and to the side. And we already had you turn into my face, so I'm going to have you lift your arms out like this and then put them down by your side. And raise them up in front of you like that, and down by your side. Good. And then I'm going to have you bend, flex your elbows. Good. And then flex them down. I'm sorry, actually, just extend them out. Perfect. Okay. And then can you hold them up again? And then push up against me and pull back. Perfect. And then can you push your hands out like this and move your wrists? Good. And then try to push your wrists up against me. Like move your hand like this. Yep, perfect. And then push your hands down onto me. Good. And then spread your fingers, close them, make a fist. Move your thumb out and in. Good. And can you squeeze my finger? As hard as you can. Good. Perfect. Okay. And now I'm going to have you stand up. And can you bend over and touch your toes? And stand up straight. And kind of lean back into my arm. Good. And then to the side. And to the other side. Good. And then we'll kind of hold onto the exam table here, and you can face the table with your belly button towards it, and then move your leg out like that to check your hip, and then back. Good. And then same thing with the other side. I'm going to feel it. Good. And then back. Perfect. Okay. And then while I have you standing up, I will go ahead and do what's called the Romberg test on you. So if you can kind of look straight ahead and close your eyes with your arms out like this, but your palms up. And then I'm going to count to 30. I'm just looking for any swaying or anything like that. So we would do this for 30 seconds technically. All right, you're good. You're good, Gigi. Okay, and then you can turn around and face me, and I'll have you hop back up on the counter. Forgot to do your knees here. And if you can extend your knee out, and this knee out as well. Perfect. And then try to pull back on my hands. Good. And then push out on my hands. Perfect. And then can you flex your feet up and then down, and then try to pull up on my hands and down, and just feeling your toes and the joints in your toes. Good. Perfect. Okay. Now all right, now we're going to do the Adams scoliosis test. So if you can again bend forward and kind of let your arms hang down. I'm going to raise your back up here to look at your spine, looking for scoliosis. Perfect. Thank you. And I'm now going to have you kind of walk across the room. So you'll repeat what I do. Just walk normally over to here. And then if you can walk back on your tippy toes. Good. And then if you can walk this way on your heels. Okay, and then if you could come back here and sit again on the table. And that was just looking at how you walk in your gait. I'm going to have you kind of repeat after me. So if you can take your finger and touch your nose. And again, touch your nose. Perfect. And then if you can hold your hands out, we're going to do your rapid alternating movements. This, as fast as you can. Perfect. And then I'm going to have you close your eyes in a minute, and I'm going to touch you in different places, and when you just say you feel it whenever you feel it. Okay? Ready when you are. You can close your eyes. Okay, good job. Now for the last part, I'm going to do your deep tendon reflexes. So have you had this done before? Yeah. Okay. All right, so I'm going to start here and hold this arm up. You can just let it relax completely into me. Perfect. To this side. Same thing, just let your arm completely relax. Okay, and then I'm going to have you kind of rest your arm here in your lap. And do this. Okay. Over here. Good. And I'm going to have you kind of rest your arm like this. Good. Any big plans for the rest of your day? Okay. Okay. And then her toes kind of press into my hand. And then this last one's the plantar. Okay. And then did you have any questions or concerns today? Okay, well it was great talking to you, and I hope you have a really good school year and keep doing great.